Welcome, friends, to another glowing campfire conversation on Medicare Tales and Marshmallows, where navigating the healthcare system feels a little cozier and a lot more human. Today, we're joined by someone who truly lives the seasonal dream, Marlene D., a retired teacher who splits her year between the cherries of Michigan and the palm trees of Florida. But while her soul travels freely, her Medicare Advantage plan? Not so much. Marlene, welcome. And what do we call you this season? Snowbird Queen?
You know what, Kem? You can call me whatever you want, as long as it's not out-of-network queen. Honestly, that phrase haunts me like a student with a late-term paper.
Ha! The true crime story of retirement health care. So tell us, how did you pick your Medicare Advantage plan?
Well, I wanted a plan that covered my doctors, had good dental, and gave me vision benefits. I lost my reading glasses 3 times during one open enrollment. I picked one that seemed flexible. The brochure had a dolphin and everything.
Ah, yes, beware of those cute dolphins. They'll get you every time. And how'd that pan out?
Summer was smooth sailing. Great primary care coverage, low copays, free yoga at the community center, and my dentist actually gives out lip balm. But come November, I fly to Florida for my yearly escape from snow, and suddenly I'm in what I call the Medicare Twilight Zone.
Uh-oh, what happened?
I tried to refill a prescription and was told, that pharmacy's not in your plan's network. I'm standing there in flip-flops like, ma'am, I need this inhaler more than sunscreen. Then I found out my Miami doc, who I've seen for 3 years, is technically suddenly out of network now.
Oof, that had to hurt. Did your plan offer alternatives?
They did. Sort of. It's called a visitor program, but you have to notify the insurance powers that be ahead of time and pray your Snowbird zip code isn't treated like Mars. I had to submit a form, call a service rep, and do a trust fall into the fax machine.
Sounds like Cirque du Soleil Medicare edition.
Exactly. And let's talk cost sharing. My copays double in Florida unless I jump through hoops like a caffeinated poodle. I once paid $120 for a specialist because I didn't have prior authorization. I said, honey, I barely authorized this margarita.
What's your system now?
Ooh, let me tell you, chica, I made a Snowbird survival kit. It includes a laminated list of local in-network urgent care centers, a separate Florida pharmacy card, travel-sized patients, and last but not least, a bottle of white wine labeled for grievances and appeals only.
Love it. You're my new life coach. So after all the drama, are you happy with your plan?
You know what? I kinda sorta am. I love my Michigan doctor, my plan covers dental care, and the wellness benefits are great. But I've learned this. Medicare Advantage is like planning a trip with toddlers on a budget airline. Don't assume they'll travel well. You have to ask a lot of questions and always read the fine print before you go on vacation.
Preach. Any advice for other snowbirds out there?
Yes, chica. When shopping for a plan, don't just ask what's covered. Ask where's it covered. Call your out-of-state doctors. Ask about network portability. And please, for the love of SPF 50, don't wait until you're at the pharmacy to find out you're out of network.
Wise words from a woman who knows how to pack both a sun hat and an EOB statement.
And don't forget laminated provider maps. I hand them out like Halloween candy.
I don't even know what those are, but sounds handy. Thanks, Marlene. That's all for this sunny edition of Medicare Tales and Marshmallows. Remember, healthcare doesn't always travel with you, but good planning and laminated maps might just save your stay at your home away from home. Until next time, toast a marshmallow and always, always pack sunscreen.